All right, so hopefully you all are here for pregnant cat and bottle baby training. Thank you for coming this morning. If you haven't met me yet, hopefully you have, but if you haven't, I'm Mary Chambers, foster coordinator here at Cat Adoption Team. And my co-host here is Shelby Thorpe, and I will let her introduce herself.
Hi, I'm Shelby. I've been fostering for Cat for, I think, 9 years, about 9 years. I think I've been doing this bottle baby training for the past 3. And yeah, I'm a mentor and a mentor assistant, so you may or may not have to call me at some point, and that is totally great.
Thanks, Shelby.
Yeah.
And Shelby's got a ton of experience with you know, both pregnant cats and birth and taking care of bottle babies. So she's here to help teach you guys.
Mm-hmm.
So we have it in a webinar form today. So you guys are all muted. So if you do have questions, just you can put them in the Q&A or the chat. Either one's fine, and we'll try to keep an eye on those and answer them periodically. We can also do more Q&A at the end if we didn't have anything that you wanted to cover. So let's go ahead, see if there's anything in the chat. Okay, everything looks good. Oh, quick thing before we get started, there's a quiz. So some of you guys are familiar with our quizzes already, but if you're not, there is a quiz that I will send to you at the end of the training, and that's just to sort of help firm up some of the concepts, the really important concepts that we're going to talk about today. You don't have to get like 100% in order to do this type of fostering, but you know, if you get any wrong, we ask that you just try to kind of figure out, review the materials and try to figure out what the right answer is. Okay, let's see here. So, welcome, as we already said. Look at that adorable kitten. And hopefully maybe you'd want to bottle feed that little Torby sometime. So first we're going to talk about pregnant cats, and then we're going to move into bottle babies. It's a little bit of a like weird transition, so it's not like we talk about one and then we're like, okay, now we're moving on. It's like we're talking about it in terms of the progress from a pregnant cat to when you might need to supplemental feed or bottle feeds. So if you're interested in one or the other, just know that it'll be kind of a just like a smooth transition between the two. But we're going to talk about pregnancy first, obviously, because that comes first. So cats, they are unlike, you know, humans. They actually only ovulate in response to being mated with. So that means that multiple males can mate with the same female and have different fathers within the same litter and different conception dates. So that's sometimes why you might see like smaller kittens or maybe different colored kittens than you would expect because they can actually be from different dads. So that's pretty interesting.
There are some,
sorry.
Just as a side note, because some people like myself think this is cool. There are actually some really cool sites you can look at online for coat color genetics. So if you've got a pregnant cat and you're like, what color kittens can she have? There's some really nice sites that you can look at that'll tell you like all the possibilities from the color of cat that you have, knowing that you don't know what color dad was. But that's always fun. Awesome.
Yeah, if you have the, if you know the links, maybe just put them in the chat for everybody and they can go take a look. Honestly, I haven't seen those before.
I think there's one from like CFA.
Okay. The cat fanciers. Yeah. Okay.
Yeah, I think they have a good one.
Cool. Cat fanciers. Got it. And then pregnancy or gestation lasts approximately 63 days. That's just an average, so it can be less, it can be more. Often when we get in a pregnant cat, we don't know when she was, you know, when the conception date was, so we're making a guess. So it's usually, I think most of the time we're just telling people either they're gonna pop in the next 2 days or maybe a couple weeks, and we don't really know. The most we can do is tell you that the skulls or the skeletons are starting to ossify or mineralize. So that means that they're at least 30 days along or 4 weeks along. So that's generally when we'll send them out. We don't usually know that they're pregnant earlier than that, and we don't usually send them out to foster at that point. So likely the soonest you'd have a pregnant cat is when they're about 4 weeks. So that would be 4 more weeks of waiting for her to give birth, and then up to 8 weeks before the kittens are ready to go. So that's something to think about when you take a pregnant cat, that you're gonna have them for a while. I think we might have a question real quick. And Lisa's asking, approximately 63 days from the first mating. Yeah, so that's why, you know, the first ones that come out might be like the normal size kittens, and then you might have some smaller ones that you know have been conceived later. But you know, it's all an average, and there's no real like definitive like 63 days from this date. It's just approximately.
Yeah, or you'll have like a couple born, and then the next day you'll get a couple more.
And we'll talk about that too, definitely.
Okay, preparing for kittens. I guess the biggest thing, like when you're preparing for kittens, is to give the mom like a box or a corner with lots of fluffy bedding. She's probably going to like dig around in it and try and move it out of the way. And if your flooring is not carpet, which is preferred to not have carpet, you're kind of just move it back a little bit so the kittens aren't being born on like a colder floor. But having like a box, safe area, quiet, somewhere that she, you know, feels safe delivering is going to be ideal.
So we're going to talk about 3 different birth stages, and you're likely not going to notice any of them. Maybe some of the later ones, but you know, if you're really paying attention, you might notice some of these. But I would say more often than not, people think they're noticing birth stages, and really it's not anything at all. So that's what I hear. Like, I think she's going to give birth, and then, you know, it's not when you expect it. So, but in some cats, you will see that they'll start getting restless and pacing and kind of making a nest. Their temperature will actually drop a little bit, but we don't want you to like be taking their rectal temperature just to check. Like, that's pretty stressful on them. Unless there's a concern, don't bother taking temps. Contractions will begin in stage 1, but they're not visible, so you won't see them, and this can last from 6 to 24 hours.
Okay, so stage 2 is when it's obvious that they're about to give birth, so they start contracting. You won't notice really like the cervical dilation, and don't stick your fingers up there to check. Water breaks. Okay, so each kitten has their own sac, so it's not like you're gonna see a big gush of water and then expect all of the kittens. It'll kind of be like you might notice some water, and then you know that a kitten is on its way. Let's see, and then the kitten will be born, and ideally they should come out every 10 to 40 minutes. That doesn't always happen. Sometimes the moms sort of take a longish break between kittens, and then the placenta will come out, and oh wow, I was just chatting with someone. It was like an hour and a half before the placenta came out.
That's good, because it's, you know,
yeah,
always happen the way we expected to.
Yeah. Okay, yeah, then the placenta should come out. Don't panic if it goes kitten, placenta. That happens sometimes too. It doesn't have to happen in the order of like kitten, placenta each time, because that's happened a few times recently, and it's not cause for panic. But you do want to make sure that the placenta comes out, because if it doesn't, then that can cause the mom to get really sick, because it just stays in there and starts to do bad stuff. It's not common for that to happen, but if you're there for the birth, just try to make sure. Sometimes the mom will cut the cord before the placenta comes out, so then you kind of have to watch and see and wait. And then sometimes they just wait to cut the cord until the placenta comes out and they eat it.
And as far as I've heard, if you may miss them actually eating the placenta. So, you know, if you're not really paying attention, you know, she could have eaten it and taken care of it before you even really noticed. This is always a good time to remind people that I would say most of the people that that I hear from in foster world miss the birth. So it often happens overnight or while they're gone, especially with, I think, the Shire cats, because, you know, they want to plan it. It's when kind of, you know, they want to do it when you're not there versus like the social cats who are like, maybe want you there to help. So we do have a lot of shy moms. So these ones tend to do it when you're not around, and you may miss this whole thing. And don't panic like, oh, I didn't see if all the placentas came out. We're going to talk later about like what signs you should look for that something's wrong, that will indicate that, rather than like actually watching it all happen. All right, so dystocia is the fancy term for difficult birth. So if you happen to be there witnessing the birth, you kind of want to watch out for these things. I think the most common thing that people get confused about here is that is what like active pushing means. So we say that if a kitten or if a cat has been in active labor without producing a kitten for 30 to 90 minutes, so she's up and pushing and trying to get a kitten out and it won't come out, that's an emergency. But that doesn't mean she's taken a break for 30 to 90 minutes between kittens and you haven't seen a kitten. That's normal, as long as she's taking care of the other kittens and resting and doing well. We just don't want to see her trying to push a kitten out and it not coming out. And we'll talk about, we're actually gonna talk about that right now. So that can be because of an obstruction. So physically she's not able to push them out for some reason, or because of a non-obstructive issue. So there's like a chemical thing going on. So maybe she didn't get enough nutrition from whatever food she was eating, which is why we feed kitten food. So there's a variety of reasons why a kitten could get stuck. But it's really important to remember that you should never try to pull a kitten out. And you should always call your mentor if you think something is not going right with the labor. In most cases, all kittens should be delivered within 24 to 36 hours, although I have heard of some coming 2 days later. But the thing is, you're not gonna know. When we send them out to you, we don't say like, there's 7 kittens. We might give you an estimate. We might say like, we think we see 6, but it's not definitive. So, you know, you won't know that she's not done. So you might just find a kitten 2 days later. So it's pretty uncommon, but just keep that in mind that in most cases, they're gonna be done within a few hours to up to 24 to 36 hours. It says it shouldn't go longer than 3 hours between kittens. Again, this can happen sometimes, and it's not, you're not going to know, and it's not going to be an emergency unless she's distressed or actively trying to push it out. Everybody's good? Okay.
Okay, so kitten resuscitation. So this is, let's see. So this is if the mom is like, if a kitten comes out and is kind of still in the sack and mom's not doing anything. So I always like to have like a hand towel with me if I'm, if you're there, and just take it and run it over the kitten's face to remove the, okay. So over the kitten's face is going to be the first thing you want to do, just to get it away from the nose and the mouth so that when they start breathing, they're not inhaling fluid. And then kind of hold them in the palm of one of your hands with the head at your, like where your fingertips are going to be, and kind of at a downward angle so that any fluid can kind of come up out of their nose, and just kind of rub them like like a mom would be licking them from head to, or like the head to their tail, just kind of rub them a little bit. You might have to be a little bit rigorous if they're taking their time coming to. Not rough, just like firm, and then hopefully they'll start to cry. And if the mom is not eating the placenta, which will cut the cord, if she's disinterested or full or tired, she might not do that. Sometimes they just don't really know. If it sits there for longer than, I don't know, I want to say like 6 minutes, but that might even be long. And if you put it in front of her face and she's just meh, then just take dental floss, just, unflavored, unwaxed, and tie it about, is it an inch to an inch and a half away from the kitten's body. And then cut it and throw it away. Not the kitten, the placenta. And
good clarification.
yes. Yes. Yeah, just toss it if the mom's not going to eat it. Because if you leave it there and like think, oh, maybe she'll do it, what happens is it gets cold, and then it's just like this dead, cold, fleshy thing that's like up against the kittens, and keeping kittens warm is really, really, really important. So don't be too concerned if she doesn't eat it. It happens kind of often. It's not uncommon that she won't take care of it.
Yeah. And I don't hear of a lot of people having to do this with kittens.
Really?
Yeah, I don't. I really don't. But I think because a lot of people I hear from they're like, I came in and there were 6 kittens.
Oh, I guess I get a lot of the calls.
Yeah.
When there's anything that's like amiss.
Yeah.
I mean, usually what happens, I guess the thing that I hear more of is removing the placenta and cutting the cord, but the kitten's fine. Like the mom licked them, woke them up.
Yeah.
The only other thing that happens sometimes kind of semi-frequently is the mom will it's usually like the second kitten. She's paying too much attention to the first one. And so I have to take the towel and clear their faces because the mom is like too busy still cleaning the first one. Sometimes they come in rapid succession.
And you can also encourage her, right? Like, so kind of put the kitten where she is, encourage her to start licking and taking care of the kitten.
You can try, but they're usually still attached. So like you can't really move them too far. But if you're like putting your hand back there, then she's kind of like, what are you doing?
Yeah, she might come check it out. Yeah.
Yeah.
Yeah. And if you're watching, I know it can be a stressful thing if it's your first time and you're not sure and you're watching the mom give birth and you're not sure, like, hey, is she going to take care of this one? Is she going to do the cord? The important thing to remember is that to give her a little bit of time to do that stuff. So you don't want to just like jump in immediately and start resuscitating all the kittens. Like, give her a chance to do what she's supposed to do. Because in most cases, moms will figure it out, and they do this in the wild all the time without anyone's help. So it is important to remember that and to give her a chance, but to be ready if something does go wrong. Be ready with your little floss and your a little warm dry towel and all that.
And if the kitten comes out and they're not moving and they're still in the sack, you have a little bit more time to wait. It's mostly if they come out and they're squirming and the sack is still there, and then you start to hear that gurgle noise because they're trying to breathe, and that's when you should step in if mom hasn't. Like, don't wait on that one. Just take your towel, clear their nose, you can always just put them in the palm of your hand just for a second and tilt them down so that it helps the fluid come up their nose. But a lot of times they come out and they're not moving yet, and And that gives the mom a little bit more time to then break the sack, and then she'll wake them up.
Good information. Thank you. Okay, so we're gonna do some monitoring after delivery, of course. So this is the part where we'll tell if something has gone wrong that maybe we didn't witness, or you know, just something internally with mom. So things that could happen is, you know, she could have a retained fetus she did not produce. She could have an infection of her uterus. She could have mastitis, which is when her mammaries get infected. So that would be like, you know, she'd get red, sort of hot to the touch, maybe some discharge from the nipples. So you'd want to kind of keep an eye on those and make sure there's nothing looking strange. Maybe touch them if she'll let you, and make sure that they're not too hot. I think, eclampsia. Eclampsia is the one where she has low calcium levels, I believe. And so the idea here is, I don't want you to like feel like you have to be an expert on all of these conditions. You're not, you know, I'm not a vet, you're not a vet. We don't know what all this stuff means, but what we do know is, how is mom acting? Is she eating? Is she using the litter box? We can monitor for signs of infection by discharge from her vulva. So if she's having like gross, blackish, smelly stuff coming from her vulva, that would be abnormal. She will have some like clearish, reddish, possibly even greenish discharge after the birth, and that is normal. So there will be some blood involved too. But if you're seeing like excessive blood or you know, really foul smelling stuff coming out of there, that's, you know, you're calling your mentor and getting that figured out. Umbilical cord care, you want to make sure that the kittens get that taken care of. We do have a little kit we send you with when you take a pregnant cat that has iodine, and it has little gauze or little cotton balls, and we ask that you just take a little bit of the iodine and just swipe it on the leftover umbilical cord, so it'll start to dry up, and you just kind of want to swipe that area, and that'll prevent infection of that area. That's actually a really common cause of sepsis in kittens. So preventatively, we just keep that area clean. And then of course, you're going to be weighing your kittens every day, twice a day when they're really young, and making sure that they're gaining weight. Little kittens should always be gaining weight. If they are not within a 24-hour period, we want you talking to your mentor. Now, contrast that with an older kitten. You know, you're not panicking if your 6-week-old kitten didn't gain weight in 24 hours. That's that's a little different. We actually give them quite a bit longer. I think our current standard is 48 hours of no gain or loss. But with these little guys, you really, really want to make sure they should always be gaining every day. And if they're not, we're getting something checked out. We might need to supplement, which we'll talk about later. We might need to get them checked by the vet. We might need to, you know, make sure that mom has enough milk for everybody. And if she doesn't, maybe see about moving them to a mom that does have enough milk. So there's lots of interventions we can do if we know that something is wrong. So weigh every day, twice a day when they're first born. Now, moms aren't always going to be super happy about this, especially if you have a scared mom. I know a lot of people that get bit by their moms when they are the day of or after birth, when they're trying to get the kittens, if the mom is nervous. So be really careful. Watch her closely and see if she's anxious with you being around. And if she is, wait till she goes to the litter box, or wait till she goes to get some food to weigh the kittens and check them out. And you might need to wait a day to do that if she's really, really stressed. You might have to give her a little extra time. So as much as I'm like, you gotta weigh them, you gotta weigh them, like kind of balance that out with like, how is she feeling and what will she let you do, and be careful and watch for signs of her getting, you know, defensive or too concerned with you being around the kittens.
Yeah, don't put yourself in danger.
It can be helpful when you get your pregnant cat home to start developing a bond with them, especially if they're worried. You know, start doing some churu feeding and some socialization techniques to make sure that she trusts you before the kittens come.
Yeah, and it's helpful even with moms that are super trusting and like don't mind you petting the kittens. I found it really helpful to wait until the kittens are sleeping.
Hmm.
And I know that sounds mean because you wake them up to weigh them, but they're a lot less likely to cry because they'll be like waking up on the scale and kind of disoriented. Because if they're awake and they're moving around and you pick them up and you put them on the scale and they start crying, then the mom is like, "What are you doing?" And they'll like go try to grab the kitten and like carry them back into the thing. And I've had, like where you're holding the kitten, the mom grabs them and you're still like kind of holding on to them. You're like, "No, wait." And then you have to let go and you're like, "Okay, well, fine." So waiting until they're like sleepy can help because then it stresses mom out less because they don't start crying.
Good advice. Thank you. I've also heard about moms moving their kittens around, especially if they're stressed or not feeling comfortable where they are. Like they just keep moving them to different areas. So when you're setting up your room, it's a good idea to have a really nice, well-hidden space where she feels comfortable and offer a few of those spaces. So she may prefer one over the other. She may give birth wherever she feels like it, in the middle of the floor. I think Shelby sat on her bed one time. Like weird things like will happen, but try to offer her places that are secure and try not to have an area where she can get into that you can't access her. So if you have like an area under a bed or in a closet, you'd want to block that off so that she's not moving the kittens to where you can't get to them.
Yeah. I had that cat, actually, the one in that photo. She's the one who had them on my bed, and she's the one, she figured out how to open my closet. She's the only cat I've ever had who's figured out how to open my closet. So she had them on my bed, and then she decided she wanted to move them into my closet in the middle of the night. So I woke up to a screaming kitten and a frantic mom. I went to my closet, and they had crawled underneath my shoe rack. And so I had to grab them out, put them back on my bed. And she was smart. She was like, "I'm not doing that again." And she did not try. But the other thing that'll cause them to move their babies sometimes is if the area isn't clean. So after the birth is done, you'd really want to make sure that you have like fresh bedding down because their instinct is to like not attract predators. And so it's gonna smell where she gave birth. So you kind of want to make sure that the bedding is clean, and that'll kind of lessen the chance of her moving them.
Yeah, so layers, right? So you could have like a bunch of layers of towels. So you don't have to you can kind of just pick them up and remove, one, and you have something nice and clean underneath.
Mm-hmm.
And you'll want to do that pretty often with these guys because it's a messy process. Even though mom is taking care of the, cleaning up, there's still some that gets like on the towels and the bedding, and you're going to want to change that out pretty often to make sure that it's a nice, dry, clean place for them.
Yeah, and she'll try to lick it up off of the blankets too. You'll see them like licking the blankets, and you're like, "No, lick the kitten." But that's them trying to keep the area clean.
Yeah.
Okay, kitten housing. Oh, okay, so we kind of went over this a little bit. Boxes are really great. Some people use those clear tubs, like those larger like storage tubs. Some cats really like those, just put a lot of blankets in them. And I guess it's really nice because they're easy to clean. Like, you just wipe the plastic down. I really like boxes. I really like that. So what I kind of do is sort of like the photo on the left. And I'll put like a blanket over the top just so that it feels really secure for the mom. And then if I'm there and she's giving birth, I usually just take the top or like move it off. They don't really seem to mind. Like if you're there and they're giving birth, it's kind of like they want you to be there. But I do like to cover it at first because I think that it kind of allures them to that spot. So you have a little bit more control over where they're going to do it.
Yeah, and keeping it warm too, right? So
Yeah.
We'll send you with one of those Snuggle Safe warming discs, the ones that you microwave. And we don't want that to be like directly under the nesting box, but if you can't like heat your entire foster room to like 80 degrees, which I think most people probably don't, you can use that as like an ambient heat source sort of on the side of the box or nearby. So it's providing heat, but not like where they can't get away from it, because when they're really little, it's hard for them to do that. And then mom won't like it if it's too hot in there. So
yeah, and the moms, I think their body temperatures rise just a little bit after they give birth, naturally, to keep the kittens warm. And they spend a lot of time in there with the kittens, like during the first several days after they're born. So it's not like super important. You don't have to be like heating up your room to 80 degrees. The mom will generally, because you think about barn cats, they keep their kittens nice and warm in a barn with no temperature control.
Yeah, that's usually why they choose places that are like nice and cozy and cave-like, is so that when they're warming the kittens and they're keeping that whole small area really warm. So hence the box, or some sort of smaller area that you can kind of keep really, really warm in there. The other thing about, we always talk about like cats do this outside all the time. And this is a good time to mention this, that yes, they do it outside they do it outside all the time, but their kittens often don't survive either. So they have a survival rate. It's pretty low, actually, depending on what's going on in the community and how much food is available and all of that. So they may have a litter of 7, and only 2 of those 7 will actually make it to adulthood. Whereas when they're in foster care, we can get all 7 to do well, but it's something to keep in mind that, we're providing all this extra care and support in order to help everyone survive. And that sometimes kittens don't make it as well. It's a good time to bring that up. There are stillbirths that happen, so they'll be born deceased. And there are times when within the first 24 hours, some kittens pass away. And usually, despite our best efforts, these kittens probably had something wrong with them. There's probably some congenital issue that we cannot see, or maybe something we could see. And when they're that young, there's not a lot we can do. We can try to supplement. We can try to, get them into the vet, and we can do, antibiotics and that stuff. But usually when they're that young and something's wrong, there's, not a lot we can do. So that's something to be prepared about when you take home a pregnant cat. I think you deal with kitten death a little bit more than other folks who take older kittens. Okay. So body temperature, we've just talked about this, but we're going to talk about this in terms of both moms and kittens, and kittens that don't have a mom. So like Shelby said, when the kittens have a mom, they're the one, she's keeping them warm. They can't regulate their temperature until they're about, fully until they're about 5 weeks old, but not at all when they're first born. So their temperature is lower than when they're first born, and it gradually increases to a normal adult cat body temperature. But the mom is the main source of heat, plus any support that you're providing within the nest or within the room. And we'll talk about what temperatures you want to do that in another slide. But we want to make sure that you're giving gentle heat support. So remember, just don't have them like directly on a heating pad or snuggle safe warming disc. You want it to be sort of ambient heat. And that's because kittens can't cool themselves down either. So gentle heat support is something to keep in mind.
And it'll also cause them to be dehydrated. If they're on if you put them on something that's too hot, that'll dehydrate them. Sorry. Okay. Oh yeah, this is what we just went over, right?
Kind of, yeah. I think sorry, I may have jumped ahead a little bit. Yeah, I mean, our vet does recommend if you're able to heat your foster room to about 80 degrees when the kittens are young, especially if they don't have a mom, that high temp is actually recommended and decreases as the kittens get older. you know, but like I said, most people can't do that. Some people like to do like a space heater that's safe and up and away and the cord is covered, or like I said, the little discs that you can see in the upper right corner, we will give you those, and you can use those to keep the nest nice and warm. I'll let you do this one, Shelby.
Okay, so weighing. So when they're newborns, I like to weigh them like morning and evening, kind of around the same time. So they should be gaining 10 to 15 grams. I think 8 is like the low end of okay. Let's see. If you have a kitten who gains like 4 grams one day, just call your mentor, maybe let them know or shoot them a text message. It's not an urgent situation, because then sometimes within like the next 24 hours, they'll gain like 15 grams or more, and they just have like little growth spurts. It would be nice if they were all consistent, but they're not. And let's see, it's nice to have, obviously make a chart for this so that you can, you know, write it down, be able to compare and see, like, has it been progressively like decreasing? Have they been gaining like 10, 8, 6, 4? Because then there's probably a problem. But yeah, that's kind of the basis, the basics of that.
If you, you can use your medical record sheet, which has a weight chart on it, but if you're dealing with kittens from when they're very, very first born, you're gonna run out of space. we don't give you quite enough space on there. So like Shelby said, I think some people just make like a little Excel sheet or a Google sheet, or they just write up something on a piece of paper, and you know, just keep that. That's part of their records, and
scribble.
And again, with the little itty bitties, if they've lost or haven't gained in a 24-hour period, you're talking to your mentor. And as they get older, about 5 weeks, no, I think we say at 3 weeks and older, it's a 48-hour period if they haven't gained or if they've lost, then you're talking to your mentor. All right, so what are we gonna feed these kittens? So this is where we're kind of transitioning, you know, over to bottle babies here. And we're also talking about moms and kittens because there might be cases where you have to supplement. So that's kind of the first step when you call your mentor and you say, hey, I have a 2-week-old kitten who hasn't gained weight or has lost weight in 24 hours. And your mentor is going to say, all right, it's time to start supplementing that kitten. So so if you're taking home a pregnant cat, you might be like, hey, I don't want to learn to bottle feed. I don't want to take bottle babies. Well, it's a good idea to learn to bottle feed if you're taking a pregnant cat, just in case you have a kitten who isn't getting enough milk or needs to be supplemented for some reason. So what we use to bottle feed and supplement kittens is kitten milk replacer, or Breeder's Edge is actually the powdered formula we have now. Please just use that and not any other things like cow's milk or goat's milk or cat milk. This is the good stuff. If you're just taking home a pregnant cat, we'll send you with a little like emergency bottle feeding kit, which is going to include a can of the KMR, which is already reconstituted and ready to go, just needs to be warmed up. And you'll have a bottle and a toothbrush and a little cleaning brush for the bottle. And if you're taking on bottle babies, you'll get a full canister, possibly more, of the powdered stuff, which you actually have to make into a liquid before you give it to the kitten. So those are the two options there. You want to be mindful of the powder to water ratio. So when you're mixing the powder, there's a guide on the back of the can that talks about how much liquid to how much powder. And you're going to be warming this up, and we'll talk about that. And you're going to want to make sure it's fresh. So we're going to get to the more of the details about all of that stuff in the next few slides.
Okay. How much and how often? So this depends on the kitten's age. There is a feeding and
Uh-oh.
By the age, there is like the age, and then it kind of says approximately like how much they'll weigh, but take the kitten's weight. That's going to be the most important thing. And then just like slide your finger over and see how much they should be getting. It's pretty easy to navigate. When you're weighing them, use grams instead of ounces. And I think that's what the chart has on it. So it's really important if it's a bottle baby, like an actual bottle baby without a mom, or if it's been determined that the mom is producing no milk and you're feeding them like a bottle baby, you have to make sure they are getting the amount that the chart says, like all of it. If it says like I don't know them off the top of my head, these are fake numbers. If it says like a 83-ounce kitten needs to get like 50 mLs per day, make sure they're getting 50 mLs per day of food, because that's what they need to grow. If they are fussing about it, they're acting like they don't want it, contact your mentor. You're going to have to figure out a way to make it happen. Otherwise they're just going to starve. But the chart also conveniently tells you how many times to feed them per day. So if they're supposed to be getting like 50 mLs per day every like 3 hours, or I think it says how many times. So if it says like 7 times, then just 50 divided by 7, and then that's how much they should be getting each time you feed them.
So like for newborns, it's every 2 hours.
Yeah.
And then it goes down to every like 3 hours and 4 hours as they get bigger.
Yeah, and there are a lot of different charts on this. So if you Google like how often to feed newborn kitten, like I think the one from Maddie's Fund says it's a lot more lenient, actually. It says like you can start feeding them like every 5 hours when they're like 2 weeks old or something. There's like some weird gap like between that, and then other people are like, no, every 2 hours till they're 3 weeks. Yeah, I've looked at a lot of those charts.
3 hours when they're like 2 to 3 weeks old or something, and then 4 to 5 when they get to something like that.
And if they're healthy and they're like good eaters, they'll tell you when they're hungry. Like they'll wake up and they'll cry. And if they do that and they want to eat, just feed them.
Yeah.
And then supplementing, you're topping off, so you do not follow the chart and do not force them to eat the amount that the chart says, because they are getting some from mom and you're just giving them a little bit more. And this is really good. Sometimes moms have like 7 or 8 kittens. That's a lot of kittens to be feeding. And so in those cases, kind of just assume that you're going to be topping off with some of them. And then other cases are if the mom just isn't producing very much milk and some of the other kittens have taken the good nipples that are producing milk, then you'll have to help the 1 or 2 or 3 that are kind of falling behind.
The nice thing about that is that, you don't have to, it's not like you have to get up in the middle of the night to do that. You can do those during the day, you don't have to do it during every feeding. So if you're supplementing, it's not as rigorous.
Yeah. And then overfeeding, I think overfeeding happens most often when when you're tube feeding. If you do decide to learn how to tube feed, we'll go over this. Whoever's training you should go over this again, but you really want to make sure that you're not overfeeding, because they don't have control of that. You're just putting it directly into their stomach. But I think overfeeding tends to happen more with older bottle babies, like I would say like 2-week-old bottle babies that you get that maybe have been kind of starved for a little bit. They just get really overzealous and they just want to keep eating because they've been starving. And and that'll cause their stomachs to get upset. And like, as you know, as you can imagine, if you've been starving and then you just eat a ton of food, probably gonna not end super great for you. And it seems like diarrhea tends to be the main thing that happens, but I guess constipation can happen from that too.
Yeah.
So just be mindful when you're feeding them. Like if you see that they're supposed to be getting 7 mLs and they're trying to eat 15, cut them off. Maybe, you know, like pet them and cuddle them and help them fall asleep, help them go to the bathroom, let that food settle.
Yeah, good idea. And then, you know, the other thing to kind of keep in mind is you'll know if you're not feeding enough, if they're not gaining weight, right? So the supplementing part, you know, if you end up doing that, it's kind of a little like trial and error game. Like you're gonna top off, right? And if your kitten's still not gaining weight with that top off, you're gonna be adding some more in. So you wanna keep track of that and how much you're giving, and did she gain weight on that? Did she not? Did I give too much and maybe they vomited, and you know, stuff to keep in mind.
And if you got a newborn vomiting, like a little kitten, call your mentor immediately. That's not
good.
Not normal.
No. They actually don't have a gag reflex for, I think it's like at least the first couple of weeks.
I think it's 2 weeks.
Yeah. So we talked about what we're going to be feeding them, but how do we feed these kittens? With what tools do we use? And you know, regardless if you're taking home a pregnant cat or a mom with little teeny tiny babies or bottle babies, we're going to give you a feeding kit. So that's going to include probably not that whole kit over there on the right, because we take them out of the packaging and just give you what you need. But you'll get the bottle and the nipple, and then sometimes we'll also give you a Miracle Nipple kit, especially if you're taking home full bottle babies. We'll give you one of those. We don't have them in stock to put in all the kits, but they're kind of expensive. But we will send one to you if you're doing bottle babies, because they tend to be a little bit easier to use than the nipple. You can see on the Miracle Nipple in the middle that the tip is it's much smaller than the actual nipple on the bottle. And that can be a lot easier for especially little tiny kittens to nurse on. Often that big nipple on the bottle is just too big. The Miracle Nipple also comes with a pre-cut hole, whereas the nursing kit does not. So you're expected on the nursing kit to cut the hole yourself. You can do it with like a large bore needle, or you can take some cuticle scissors and cut a little X. There's a lot of different techniques for making it right. The key is that when you turn that bottle over, you want the milk to come out as a slow drip. It shouldn't flow out, but it should come out. So if you turn it over and it's not dripping out at all, then your hole's not big enough. If you turn it over and it's just pouring out, well, you got to start with a new nipple because you got it too big. So that takes a little bit of practice, and your mentor can talk you through that as well.
Okay, so warming up the formula. So you want it to be warm, not hot, but warm. Don't microwave it. So what I usually do is, so if you have like a can, whatever you do, if you have the can or if you have the powder that you have to mix, just put it in a container. You can put it in the bottle, and then just take like a mug and put that in the microwave, like a mug of water in the microwave. You can boil it if you want, but like that just takes longer. And then take the bottle or whatever container you have your KMR in and put it in the heated water so that it warms up that way. And then check it on your wrist like it's showing in that photo, just to make sure that the temperature is warm. You definitely don't want it to be cold because they can't digest that, and you don't want to burn their mouths if it's too hot. So you just want it to be warm. You don't have to like stick a thermometer in it to check. but you'll be able to tell just like on your wrist if it feels like a comfortable heat, like that a kitten would want to be drinking.
Sounds good. Most important thing when bottle feeding is that the kitten should look like this. You'll see some photos and videos of out there, unfortunately, of people holding kittens on their back like a baby, but that is not correct. You want to have them like they would be when they're nursing on mom. So think about what they look like. They look like that, right? They're in that position, and they're nursing on mom. So that's the appropriate way. And the reason for that is they can actually aspirate formula when they're not held properly in the proper position. So this kitten, of course, is taking this very nicely without any encouragement. This kitten is clearly experienced with the bottle. I can tell you this probably won't be your first try. It's not going to look like this. And we'll talk about some techniques for holding a kitten and how to get them to nurse in some future slides here.
Okay, so if you have a kitten that won't nurse, it's nice to kind of go over a list, like check these things. So the biggest one seems to be they're not used to the bottle or the nipple. It's foreign to them. They think it's weird. It's, you know, it's not their mom. It doesn't smell right. So there are obviously ways to help with that, but we'll go through this list. The bottle or the nipple might be too cold for them. So sometimes it's good to just like dip it into the KMR. The hole in the nipple is inappropriately sized. So if they do start trying to suck on it and then they stop, it might be that it's just too hard to get out. They're not getting anything from it. So why would they continue? Or if they start choking, like if you start see it coming out of the sides of their mouth, it's probably too big. So you'll want to get another nipple and try again. Formula too cold. I would not rely on this one. I don't know that a kitten's going to stop unless it's like cold, like you just took it out of the refrigerator. I don't know that they would stop really. Because sometimes I've like checked like in the middle of feeding that I've checked the thing of formula that I've had and I'm like, oh my gosh, like that really cooled off quickly and they still eat it. Formula not fresh. If they're full, they're gonna stop eating. If they're sick, they might not want to nurse because their stomach hurts, or it might be that it's impossible for them to nurse because their nose is so stuffy and it's really hard to suckle on a bottle when it's like trying to drink through a straw when you can't breathe through your nose. Let's see.
So with the formula not being fresh, Shelby, how often do you mix fresh formula from your powder?
The powder every 24 hours. I usually like to take like a sticky note and put it on if I'm not making it each time and I am refrigerating it, I like to put a sticky note with the date and the time that I mixed it, because when you're bottle feeding and it's and you've got bottle babies that are waking up in the middle of the night to feed and you're making formula like every day, it's really easy to forget like when you last made that formula. So I like to just put a little date on it, or date and time, so that I know when I have to toss it. And then the canned stuff, it's good for 72 hours after you open it, like the pre-mixed stuff. But the one that you're mixing, the powder, that's only good for 24 hours after you mix it. And you do have to refrigerate I want to call it the can of it, the container. You have to refrigerate the powder stuff after it's been opened. Let's see. So things like other things, that make people or kittens sick, dehydration, low blood sugar. They're not doing well, so they're not going to want to nurse. They're too sleepy. The big one is a congenital defect. So if they have a cleft palate, they physically, depending on the severity of it, they physically cannot nurse. or if they're too old and ready to be weaned, they usually start biting the nipple instead. And sometimes it's something really simple, like they just need to pee or go to the bathroom or poop or burp. And so, you know, if they need to do that, sometimes the first thing, if they are not wanting to eat and they've typically been good eaters, is just stimulate them, see if they have to go to the bathroom. And a lot of times they do, and then they're hungry. But those are all.
Lots of reasons, huh?
Yeah.
It's kind of like a little detective work that you have to do, like, what's going on with my kitten? Why won't they nurse? And some of this, you know, you're not going to be able to tell. You're not going to know that they have a congenital defect unless you've experienced that before. So some of this is where you're bringing them into the vet. So don't feel like,
and
no.
And hopefully, I don't know, I mean, maybe not, but it's pretty easy too if you like open their mouths and just look at the top of their mouth. If there's like a big like gap, that's a cleft palate.
Right, it's where the bones up at the top didn't fuse properly, or I can't remember exactly what it is, but they get like a gap in there, but and then the formula can actually get up to their nose.
Yeah, you'll see it come out their nose.
Yeah, and I think I'm trying to remember if there's another slide where we talk about kind of how to hold the kitten to get them to nurse. Let me see. Oh, this is talking more about that, but I'm going to send you guys some videos from Kitten Lady after this, and videos I think are really great training tools, and you know, you should bookmark those and have them available in case you are having issues or you can't remember things, because I think a lot of people just want the kitten to just automatically latch on and just nurse, and a lot of times you actually kind of have to hold them. Like Kitten Lady shows a hold where she actually has one of her fingers on the throat of the kitten where she's feeling if the kitten's swallowing, which is really important so that they're actually, you know, nursing and not just suckling. And so she kind of holds the kitten's head in place, and then she feeds with the other one. And kittens might fight you at first, you know, they're going to be like, no, I don't want that. Like, I don't know what you're trying to do. I don't know you, you know, and you kind of have to make them kind of get used to it. So I think, Shelby, in the past trainings, you said like you'll put like a little drop of the formula on their tongue. You're not like forcing it, so you're not squeezing the bottle, but if you just put a little drop of that formula on the tongue and they get a taste of it and they're like, oh, that's food, then they might start to nurse. So some of it is a little bit of a tough love at first, and kind of holding them in place and getting them to realize that it's food and start suckling. So I'll send you guys those videos so that you can kind of have a better idea of what I'm talking about with an actual kitten. I don't put them in these presentations because for some reason videos never play on my PowerPoints. Like, I try to play them and it's always a disaster. So you guys can check those out later. But I encourage you to follow Kitten Lady on, like, you know, Instagram or YouTube or all of her on her website, just to watch all of her videos. They're amazing. So we're trying to get that kitten to nurse. Again, you know, proper technique, looking for all the things that they're that could be wrong. The other things you can do are try to take a little break and try to get that kitten to feel more comfortable. So the toothbrush can actually act like mom's tongue, and that's why we give you a toothbrush, is that you can groom them, but you're also like stimulating them to feel like mom will often groom them while they're nursing or between nursing, and that will make them feel comfortable. It'll make them feel like mom is around, and it might encourage them to nurse. Pet the kitten, make them, like Shelby said, you know, try to get them to go to sleep, you know, do things that make them feel comfortable in order to get them ready to feed. Again, you know, if they need to pee or poop, they're not going to be able to nurse. So we're going to talk about elimination needs on a later slide, but attend to that if it's needed, and then work on your formula if that's not correct. And then if you really can't figure it out, like, you know, there might be something else wrong, or it may be a case where we need to do some tube feeding, and that's where we actually like stick a tube down there and give them the formula via the tube, and we'll talk about that as well. But that's, you know, obviously before any of this, you're talking to your mentor, and your mentor's walking you through all this and trying to help you figure out how we can get them to nurse and whether or not we need to get them into the vet.
Syringe feeding, I really prefer syringe feeding over bottle feeding. I feel like I have more control over it, and it's also a lot easier to measure how much they've gotten. Especially with newborns, I would really encourage using a syringe. The one thing that might be confusing is that the syringe has a plunger on it. Don't press the plunger. The kittens, their suckling will just pull it down on its own. So yeah, don't try to force feed. You know, like if you're just pushing on the syringe and like forcing milk into their mouth, it's gonna get into their lungs. They're gonna choke. You don't want that. So
they get pneumonia. Pneumonia is not good.
yeah. So basically, and of course, if you're first starting to bottle feed them or syringe feed them, they have no idea what you're doing. You're trying to stick some weird thing in their mouth that they don't recognize. You can always just take just dip it in the formula so that it's already got some on it. Or what you can do is when you get it in their mouth, just depress the plunger just enough for a drop to come out and get on their tongue. Because then they're like, oh, that's food. And sometimes what'll happen is they still kind of won't understand, but you'll know they're interested because they'll start smelling. You'll see them like moving their head forward and like searching for something. And that's when you really want to get the syringe back in their mouth, put another drop on their tongue. And a good amount of the time they'll get it from there because the suckle reflex will kick in once the nipple's in their mouth and they're wanting to eat, and they'll just take your finger off of the plunger. And like you can see my thumb in this photo. That was one of my babies. It's not on the plunger. It's by her arm, and she's just sucking it down by herself.
Yep. And I think, those little Miracle Nipple kits come with a syringe, but you will find that over time that syringe is not gonna, it kind of gets tacky and won't quite like flow when the kitten sucks on it. So I think, Shelby, you've used in the past just like a little bit of olive oil around the ring to kind of get it moving again. Or
I haven't tried, but people have said that works.
Okay.
Those ones, thankfully, the ones that come with the Miracle Nipples, those ones tend to last quite a bit longer than the ones that the shelter sends home for like Strongid.
Mm-hmm.
Because the nipples fit on those too, but those ones definitely those are like, single use type, not meant to be used over and over and over again. But the Miracle Nipple ones, thankfully, they tend to last longer without getting sticky.
Yeah. And we'll talk about cleaning your stuff too.
Yeah.
Okay, so syringe feeding formula, that's an option if you can do that safely. And then tube feeding, this would be something we would teach you individually if your kittens need it. So this can be a really safe way to get your kittens nutrition when they can't nurse for some reason. So say they have an upper respiratory infection and they can't breathe through their nose because it's all stuffed up. We might need to just put the formula right in their stomach. It sounds scary to put a tube down into a kitten's stomach, but it's actually super duper easy. And it's really safe when done properly. So our vets' preference is that people just learn directly from the hospital as needed. So if you do need to learn, we will set that up. We'll set up an appointment for you to come in, and we can still do that now, despite COVID. If you're comfortable with it, we can have people come in and wear masks and try to distance as much as possible, and just work one-on-one with somebody to learn how to do this. Yeah, great skill to have.
Okay, burping. So kittens, you gotta burp them after you feed them, just like babies. You can do it kind of however you want, like if they're laying down, like on their stomachs. I like to hold them up on my shoulder, kind of like a baby, and just drum my fingers gently on their back. You can use a toothbrush too. That's sweet. And just like brush them like a mom. And they will burp. You'll hear it. It's sometimes it's like a little burp and you're like, was that it? It was probably a burp. Or it's really loud and it's really cute. But you won't miss it, sort of thing. And if you're doing it for a while and they're not burping, it's not like they're going to die. You know, it's not like awful. So you can always put them back if they don't successfully give you a nice burp afterwards. Just, you know, next time, or if they start seeming fussy, then try again. But yeah, pretty basic, pretty easy to do. Sometimes it takes a while, but it's worth it because it's cute.
Okay, so we're going to talk about elimination. So if you have a mom and kittens, mom will take care of this usually, although I have a mom cat and some kittens in foster right now who mom is not doing, which is, you know, always disappointing. But so there may be a case like that where you have to step in and help out. But with bottle babies, you definitely have to do it. So they can't go on their own, or at least not well, until they're about 3 to 4 weeks old, which is when you start introducing the litter box, right? So you actually have to stimulate them. Usually, some people do it before, some people do it after feeding, or both. Sometimes if you can't get them to nurse, you might do it just to make sure they're ready to go. I would say I always do it before if I'm in a bottle feed, because I want to make sure that's taken care of before we get started, so that, you know, isn't a potential issue.
They're feeling good.
What's that?
They're feeling good. They like empty their bladder and now they want to eat.
Totally. You can use gauze, you can use washcloths, you can use toilet paper. I would say if you got bottle babies, you're probably going to go with something cheap like toilet paper, because you're going to be doing it a lot and using a lot of it. It's pretty easy to get them to pee. All you have to do is like kind of touch that area pretty gently and they will start peeing. You don't need to be like really forceful or vigorous, because that will actually cause irritation. You just kind of, you know, you can just kind of put it up to their genitals and they will start to pee. I've heard that with boys, it's a lot easier than girls, but in my experience, it's pretty easy to get either one to pee. Now, getting them to poop can be a little bit more challenging. But the key is to just use a gentle movement. A lot of people like to do like kind of a circular gentle movement just right under the tail. And you'll probably have to use, if you're using toilet paper, you're gonna have to kind of keep, in their peeing, you have to kind of keep rolling that toilet paper in because it'll keep soaking it, right? So you might want to be doing this over like a trash can or a, you know, somewhere like a toilet, something like that, so you're not just getting pee everywhere. But you'll kind of learn that as you go. You can also use a warm, damp washcloth to stimulate mom's tongue, because a washcloth can kind of have that, you know, mom's tongues have those like barbs on them, so it's actually kind of rough, and it's also wet. So you could, you know, you can use a damp washcloth to do that too. The really key is you want to keep the kittens dry and clean. So you don't want to leave them wet afterwards. You want to make sure everything gets nice and dry, and there's no leftover pee or poop that could potentially cause irritation to them, or if they're wet, they could get cold.
Okay, common elimination problems. This one's easy to avoid. Just don't be too rough. Don't, like, you know, you just be gentle. Their skin is already really sensitive, and down there it's going to be even more. Constipation. This is a common one, and it is not fun to deal with. But what you can do is you can add just a little bit of pumpkin to the formula, and the that should be in your baby bag already. And it's just pumpkin. It's not like pumpkin pie filling. It's just pureed pumpkin. And then you can also dilute the formula with, okay, sorry. I just got a notification. I can dilute the formula instead of doing 2-to-1. So it's 2 parts water to 1 part powder. You can do it 3-to-1. And so 3 parts water to 1 part powder. Let's see, if there's diarrhea, you can dilute the formula with unflavored Pedialyte. I do this when they're constipated too. I use Pedialyte because it helps with hydration. And sometimes if they're dehydrated, it's because they're constipated. It can be due to dehydration. The Pedialyte will help with that.
Pumpkin can help with diarrhea too. So they're kind of interchangeable, all that stuff.
Yeah. Avoid Desitin, which is what we used to use, I think.
Diaper rash cream for humans, yeah.
Yeah. You should get like a tube of A&D ointment. If you don't, then like, Vaseline can always help. Don't be like sticking it in them, but you can use it to like on the outside to kind of help guide things out. Sometimes what helps too with constipation is if you just take your thermometer and take their temperature. Can kind of help like stimulate a little bit. Don't be like sticking it in there, like moving it around. Just do it like you would just, take their temperature. Just put it in just far enough to get their temp and then remove it. And sometimes that'll get things going.
Because you're using the lubricant. That makes sense. Yeah.
Yeah. Yeah. And then just make sure that they're clean. Sometimes they'll pee on themselves. If that happens, just clean them up. It's not like something's wrong. It could be that, they were crawling around and they brushed themselves up against a blanket and it stimulated them. Their bladder was full and they pee. And so you'll just want to make like dry them off, because if that pee or if they have diarrhea and like it's all over them and it's sitting there, it's really acidic and it's going to scald, and you don't want that to happen. So just make sure that they're dry, and after you help them go to the bathroom, if they still have some on them, just really make sure that you're getting it off. And if you need to use like a damp towel or whatever to make sure that all of it is off, that's fine. Just make sure they're dry afterwards.
Great. All right, grooming. So mom usually does the grooming, right? Well, guess what? If we use our bottle babies, we got to do it. So we do give you a little flea comb in your baby bag, and that's not just for fleas, that's also for grooming. So that's your first course of action when you've got a kitten that you need to keep clean is the toothbrush or the flea comb. Really brush them down nice and well. You can actually get a lot of like dried material off of the kitten's fur just with that flea comb and not have to give them a full bath. But if you do need, say they're having diarrhea and you do need to bathe them, you should just bathe the areas that you need to bathe. So usually it's like a butt bath is what we're dealing with, or say they're in the weaning stage, and they're getting stuff on their face, then you're dealing with like a little, just quick face cleaning with a warm washcloth, and making sure that whatever you do get fully wet is getting fully dry before you leave them on their own, because again, they need to stay pretty warm, and they can get chilled really quickly. So you can see this kitten in here is getting almost a full bath here. So that's the last resort, but you can do like just a little butt bath in a sink like that. If they're having a little bit of loose stool, just use the baby shampoo we provide because it's nice and gentle, and use warm water and just gently get the material off and then get them nice and dry afterwards.
Socializing. So this is a big problem, especially with singleton bottle babies. They think you are their playmate. I mean, you are, but they think that your hands are are toys. Like it's like another kitten that they would be attacking and playing with. So when they're singleton bottle babies, the shelter, once they're like old enough, are vaccinated, or they can get another kitten that's been vaccinated, because the county shelters do it at like 4 weeks. Try to get them a friend that's around their same age, because that really, really, really helps with the crazy, like, I'm gonna attack your hands thing. And it's like classic single bottle baby kitten syndrome. But yeah, just make sure that if they're going for your hands, just take a toy and put the toy in your hand and replace it. So they're playing with that, because you don't want them. It's really cute when they're little. It's not so cute when they're bigger. And let's see. And yeah, other cats can help teach them really valuable lessons. So their moms in particular, sometimes you'll have a mama cat. One thing that I get contacted about sometimes is my mama cat is being really rough with her babies. I'm like, okay, well, are they, like, what's going on? She's like, oh, she's bunny kicking them. And I'm like, oh yeah, that's, they'll bite them, they'll bunny kick them. And it's their way of setting boundaries. I don't know if any of you guys happen to be horse people, but horses kick each other fairly often. And it's just a communication thing. Like, we might look at it and be like, oh my gosh, but for them, that's just how they communicate. So if you do have like a litter of kittens, and you happen to have, and without a mom, and maybe you happen to have an adult cat who is friendly, and the kittens are old enough, like, 6 weeks and vaccinated, and you want them to meet, that can always be beneficial for them too, because then they're learning communication skills from an adult cat. And those are really,
your adult cat might get very annoyed with
yeah, you gotta be careful. It's helpful to know beforehand, like, if they're good, like if they like other cats, but they will help set boundaries too, because some cats are really tolerant, and they'll let kittens jump all over them and bite them on the face and do whatever. And other cats will set boundaries. And it's really important for them to learn those boundaries, so that when they're adult cats and maybe their adopter gets another adult cat, they're not like socially awkward. Like, they'll understand, like, when another cat's telling them to back off, so that they're not pushing the limits to where it's gonna escalate things.
Yeah, and if you're experiencing that, if you've got a singleton, there's a lot of options. Like, I think a lot of times with like single bottle babies, like, we'll also try to put them on another mom with kittens too, because that can be really beneficial to them long term. But it kind of depends on the situation and what we have available. But we can definitely try to get them a friend. There's always an inherent risk involved in that. Like we said, we want to make sure they're not ill. So anytime you introduce a kitten into an unknown kitten group, you're taking a risk of if that kitten brings an illness with them. So that's why we have to be extra careful, and we don't just like mix litters willy-nilly. And we try to do a 2-week quarantine before we put them together. So there may be like a bottle baby with one person and another over there, and then they've done their quarantine, everybody's healthy, and then we can make them friends. Woo. Best scenario. Okay, so we are going to be doing some monitoring, just like we do with any cat or kitten in foster, but it's a little bit different with little babies. So when they're really young and their eyes aren't open yet, and they're, a lot of these like tests we use with older kittens don't quite work as well with these little teeny tiny babies. So you want to keep those in mind. So for hydration, we might do the like skin test, where you kind of just pull up a little patch of skin right on their neck, the back of their neck, and you see if it goes down quickly. And if it goes down on its own quickly, then they're hydrated. And if it kind of sticks up a little bit, they're dehydrated. That doesn't work as well on little teeny tiny kittens. And neither does the gum tackiness. So in an older kitten, you can actually run your finger along their gums, and if it's tacky, that means they're dehydrated. But again, this doesn't work as well with little little tiny babies. So the biggest thing you're going to be looking at is the color of their urine and obviously their weight. So, you know, if they're gaining weight well, they're probably well hydrated. But if they're not, and their urine is like a dark orange, that can mean dehydration just like it does in people. So their urine should be a light yellow color. Fleas are always a concern. So we have some pretty strict protocols on what flea control we can give to what age kittens. So if you're dealing with kittens under 4 weeks, we have a pill that they can get, and they can get it in, if they're too young to get it via mouth, they can actually get it via their rectum. But there's also ways of dealing with that that include like baths and combing off the fleas. So talk to your mentor about that if you are seeing fleas. Hopefully by the time they come to you, you aren't, because we've taken care of them already, but sometimes some get missed, or you know, some eggs hatch that we didn't catch. So keep an eye out for fleas. They can make a kitten anemic pretty quickly. Hypoglycemia, that's a fancy term for low blood sugar. So, you know, that would be the kitten's not getting fed often enough, or not getting fed enough during a feeding, or has something wrong with him, and that's why you can't maintain his blood sugar. So, you know, you're watching out for that. For if you have like a listless kitten who's not responding, that might be a case of hypoglycemia. So that's just always something to watch out for. Upper respiratory infections, they can happen in little teeny tiny babies too, like we talked about. They can get just the same symptoms where they have like goopy discharge, and they have, you know, they can sneeze, they can get the associated conjunctivitis where they get goopy stuff coming out of the eyes, and that can happen even before their eyes open. So you might see just like a closed eye, but a little bit of swelling, or it might start to seep a little bit of discharge, and watch out for that, because you know, we want to treat that right away so it doesn't cause injury to the eye long term. Again, these are all things you just let your mentor know if you're noticing them. And then fading kitten or failure to thrive. This is a term that it's kind of controversial, but it's, you know, sometimes kittens just don't do well despite the best of our efforts. And they may have some congenital issues, or they may just be overwhelmed by an illness that happened to the litter. Obviously, we're going to do our best to try to treat any conditions, and try to intervene, and try to supplement and give antibiotics and do everything we can. But especially with little bottle babies that don't have a mom, or that got taken away from their mom very young, often they don't have the immunity that they should be getting from mom's milk, and they just don't do as well on formula, of course, as they would with mom's milk. So we do see some that just don't do well, or they were just so far behind when they came to us that, you know, there's only so much we could do to keep them up. So something to keep in mind, that there's some that don't do well, and sometimes we find out what happened with them, and sometimes we don't. So you know, our doctor will do necropsies on kittens that pass away, and try to figure out what happened, and sometimes comes back with an answer, but sometimes it's just it could be this, it could be that, and you know, nothing you did wrong, and just want you to be aware that things like that can happen.
I think metabolic disorders are pretty difficult to diagnose.
Okay. Yeah.
Sorry, I was gonna show an example of like an anemic kitten, but my computer screen is super bright, so you can't actually see the difference between Nala's paws. On Instagram, it's really obvious, but like on my computer, it's not. Oh yeah, it was gonna be a good example of what pale looks like.
Oh yeah, yeah.
Like a pale kitten.
Right, and that can be like their gums. You can look at their gums. Did you see it in another part of the kitten too?
Oh, her paws.
Oh, her paws.
Her paws, because she was like a buff colored kitten. Her paws, here, like, let me see if I can flip this. Where is my, okay. I don't know if you can see the screen. Her paws here. You can't tell in this because it's super bright, but like they were so pale and tacky looking. And then we actually did we actually did a blood transfusion on her because her sister died of fleas.
Yeah, wow.
And the minute I brought her home, like her nose, her gums, her tongue, because her tongue was white too, and her paws were just all like bright Easter pink.
Wow.
It was, yeah, the difference was amazing. Like, I had no idea I was going to bring her home and it would be like that already. But
yeah, fleas can really do a number on a tiny kitten.
yeah, doesn't take a lot of them. Okay, so crying too much or not enough. If you've got a kitten if you first bring your kitten, a little one home, or like a group of little ones home, and they are just screaming and screaming and screaming, if they're like newborns, they're calling for mom. They want their mom, and the best you can do with that is just, comb them with a toothbrush. Try to get some food in them. Give them a warm area. If it's a singleton, give them like a stuffed animal that they can snuggle with. That's something that's just going to take time because they're crying for their mom, and you don't have her. So if they're crying a lot and they do have their mom with them, call your mentor, because that's kind of an indicator that there's something going on. Like if the mom's groomed them and is paying attention and they're just crying still, there's probably something going on that needs to be addressed. If they're not crying enough, probably means that they're lethargic, and you should start looking into, like, check their gums, sort of mess with them a little bit. Sometimes they're just sleeping, and if you wake them up, they'll start crying. Try not to do that a lot. Sleeping too much is also an indicator that there's something wrong. Like if they're not waking up to eat, or if you're trying to wake them up and they just want to fall back asleep, it could be low blood sugar. It could be dehydration. It could be a lot of things. I don't know about not sleeping enough.
Maybe if they were crying and not sleeping while others are.
Yeah.
I think this is more like tracking changes, like, you're going to know your kittens after a period of time. And if you see something start to be like different about it, one of the kittens, that's really what we're looking for here.
Yeah. Yeah. And subtle changes are important. So they're hard to detect when you first get the kitten because you're still getting to know them. But if you've had them for a little bit of time and you've noticed that like one kitten does this, another kitten does this, and you kind of just see their personalities. If there's a shift, like something changes, like maybe one of them all of a sudden isn't eating as vigorously as they normally do, or maybe you have one who is a good pooper and would poop every day, and then you couldn't get them to poop for a day, which would, some kittens go like 2.5 days without pooping, which can be very normal. But again, it's just like if you've got one who's consistently pooping well, like good poops once a day, and then they don't poop one day, just note that, just so that you know. I like to, along with your weights when you're weighing your kittens, I do like to keep sort of a chart or like just notes that say pooped at this time and then what it looked like. So like, was it super liquidy? Was it super hard? And those are really helpful for when you're calling your mentor if there is a problem, so that you can tell them like when the last time they pooped was, what it looked like, because that can help your mentor kind of figure out what might be going on and what a next step might be. But yeah, demeanor. I feel like demeanor can really be determined by their poops. If they've got good poops, their demeanor is probably going to be pretty good and like consistent. But if the poop starts to change, it's almost like you'll notice that they their demeanor kind of is shifting a little bit.
I feel like that happens with all age kittens, doesn't it?
Yeah, exactly.
Start to get the diarrhea and then everything's not feeling great. So we already mentioned Snuggle Safe warming discs, but just gonna plug them here again. You know, you're gonna get one if you take little kittens home, and please keep it sort of in their nest or with them or near them so that they have that heat support. And with these, there's a little chart on there for how often how long you put it in the microwave, depending on the wattage of your microwave. At the one at work, it's like 5 minutes, and you have to reheat them every 8 hours. So if you're leaving it overnight, just do it before you go to bed, and then when you wake up in the morning, and then sometime midday, and keep it with them. So even when they come in for like a vet visit or wherever they need to go, you want to keep it in the carrier with them as well so that they're warm during transport.
Development. So this is helpful, like if you just get kittens and you're trying to figure out the age. The shelter typically will have them, or will have like an estimated age on them on their paperwork, but this is kind of how they help or determine that. So their eyes typically open between 7 and 10 days. This isn't something that you'll really check. You won't check for this, but they won't have a gag reflex until 10 days of age, which is really nice for when, if you're tube feeding and they're less than 10 days old, they don't have a gag reflex. So like you just slide the tube right down, like no issues from them. Ear canals open at 10 to 14 days. So their little ears are closed, and then you'll start to see them sort of like, you can actually, at 10 to 14 days, you'll notice you can actually look down into the canal more. And it's really cute because if you make a noise or like something, there's like a loud bang or something falls or whatever, like their little heads will pop up and it's cute. They might hiss. They can start regulating their body temperature at about 14 days, and that is start, not, if you got a 2-week-old kitten, they still need a heat source. That's just when they can start kind of doing it. So their deciduous teeth, so their little cute little milk teeth, the little front ones will come in at about 3 weeks, and they'll begin to urinate. Okay, this one is kind of difficult. And not really. They can urinate and defecate on their own when they're newborns. Like it happens. You'll like, they'll poop and they'll pee, and like sometimes you'll get there, you know, a little bit too late and you'll have to clean up a little mess. But 3 to 4 weeks is when they'll start like kind of consciously going on their own. Like they'll go look for a corner and squat to do it somewhere else rather than just like laying there and peeing on themselves. And that's when you want to start introducing a litter box. I like to keep them in a small area and put litter boxes in the corners. Or what actually really helps is making sure they're in a contained area and putting, or they'll have an accident. They'll go to a place to go to the bathroom, and I just put the litter box there. And that usually just, that's it. They're done. They're trained. And their iris color, so they're all born with like blue eyes, like bluish gray. And that'll be mostly finished at 8 weeks of age. So they're true color. So they'll be like a green or an amber, another pretty color, or they might be blue still.
Siamese, or color point kitties, I guess is what you should call them. They'll keep those blue eyes. And I think that iris color change starts at 6 weeks, but is complete by 8 weeks. So if you guys are interested in like teeth, Shelby was saying they get their little incisors in. Those are little grooming teeth. They get those at 3 weeks, and then they start to get their canines at 4, and then they start to get little premolars. Their first set of premolars around 5 weeks. So if you're curious, watch your kittens and check out their teeth and watch them come in. It's kind of fun. that's the big way of how we age kittens. We use combination of weight, body condition, like how, you know, do they look like an appropriate weight, and teeth, and like what general, you know, development stages to kind of figure out how old they are. But it's always a guess. We don't really know. Okay, so weaning. So just like, okay, either you have a mom and kittens or you got bottle babies, either way, these kittens need to get weaned at some point, right? We want to start introducing wet food to them at about 4 weeks, because that's when they really can start eating that. They might not be interested, they might be interested. Sometimes you can just put out regular wet food and they'll chow on it. Sometimes you got to make like a nice slurry that's warmed up with some Camar added and maybe some baby food to get them encouraged on it. Sometimes you just got to put a little bit on their lips and they lick it and then they go, oh, that's food. Sometimes they only want mom's milk and they don't want to wean at all. Or they only want the bottle and they refuse to wean. So there's some steps you can take. You can talk to your mentor about getting him to wean. You can actually, if you're feeding them via bottle, you can mix some of the food into the bottle, like really blend it up so it's nice and smooth so they start getting that flavor of the food. That'll help them transition. Or if you have a mom and they're refusing to wean, you can actually separate mom from them for longer periods of time. So, you know, they won't be super happy about it, but they'll get hungry enough to start weaning. And I know this, you know, maybe wouldn't be super important in like the wild, or if you plan on keeping all of these moms and kittens, but it is pretty important when we're trying to get them adopted out by a certain age, because they can't be coming into surgery and going home if they're not weaned off of mom's milk. And I see it, like kittens will be like 7 or 8 weeks and the foster parent will be like, well, we have surgery scheduled like this week and my kitten's still just drinking from mom. And I'm like, oh, we got to get that taken care of. And we can give them longer if they need it. Obviously now we're not just going to be like, no more mom for you. Like we want them to keep gaining weight. We just want to progressively get them closer to eating the solid food. So separating mom for longer periods of time and you know, making the food smell really delicious and putting it on their mouth and encouraging them to eat and offering different types can really be helpful. It is a very messy process, as you can see. You want to offer it in like a little shallow dish like that so that they can get to it. They're going to walk in it. They're going to get it all over their faces. It's going to be challenging for you. Some people I know like to take a tub and just put them in there with the food and then just like do a, you know, wipe down afterwards so that it keeps it kind of contained until they figure it out better.
Baby cat's a good food. I don't have experience, I don't have a lot of experience with the wet food, but the dry food tends to be like kitten crack. So if you're using something else for dry food and they're just not really interested, getting the baby cat food usually does the trick. It's the pieces are really small and they're like greasy, like
Yeah,
oily. Yeah, it's really like a lot of it. And for whatever reason, kittens just seem to take to it like right away. So if you're struggling with like a dry food, I would try baby cat for sure.
And we do keep that generally in stock at the shelter. It's one of our alternative kitten foods. We have to purchase it or we get it donated through our like kitten shower or other means. So, you know, we don't just, that's why we don't just send it with everybody, because the Purina Pro Plan's free. So if you do have some trouble with getting kittens to eat, though, we do have it in stock and we'll just give you a bag of it. We have the wet food too, but like Shelby said, it's mostly the dry that the kittens seem to really go for.
Yeah.
It like smells better too. I've smelled the Pro Plan versus the baby cat. I'm like, I'd eat this.
Mm-hmm.
I don't even eat meat, but it just smells better. All right, litter boxes. So we talk about this during regular foster training, so I'm not going to go into too much, but it's the same thing. Then you want to use the shallow stuff to when they're starting. So you can use like a little cookie sheet or one of the little short-sided wet food containers, so that they can easily get in and out of it. And it's good to have like a few of them, and put them in the corners. That's where kittens tend to go. And use the pellet litter, not clumping, obviously. And if you notice the kitten's going somewhere else, then try to put the litter box in that spot, or take the poop or pee and put it in the litter box. I know some people, when they're doing bottle babies, they'll like stimulate to limit them to eliminate, and then they'll put the tissue in the box, so that the kitten associates the box with that smell. So a lot of kittens will just take right to it. Some kittens might be a little bit more challenging.
I would love to know where that green litter box is from.
Right? I've never seen that. Anything like that.
I have one like that, but it's a puppy litter box.
Oh.
I got it for Narvi and Telesto, the CH kittens that I had.
Yeah.
Because I needed like a low size. It's big because it's for puppies. But it's got that nice lowered front end to it.
Huh.
But
yeah,
I love
where this picture came from.
Yeah, I'd love it, like a standard cat litter box sized one. But the rabbit ones are pretty small. I looked up a ton. I looked at like the ferret ones. I was just looking for a low, that nice dip to it.
Yeah. Huh. Yeah, I know. We show that. I should know what that is or where it came from, but
like even like the kitten litter boxes from like Petco and PetSmart, they're
tall. Yeah.
They're tall. Yeah, they're just like smaller in size, but like they're still tall. And like, what's the point of this?
Yeah. No, I know.
Someone has to work on that.
That's why we always just say use the disposable or the or something else that's not really a litter box. Honestly, it's a lot cheaper sometimes to buy things that aren't really a litter box. Like I bought a Rubbermaid bin for my cat that's nice, has nice and tall sides so that he doesn't kick the litter everywhere. And that was way cheap. It was like $8, whereas like a litter box that size would have been like $30.
Yeah.
So sometimes alternative things to make great litter boxes. I know in foster training we recommend like cookie sheets, or even like really cheap stuff from like the dollar store that has like a low side, like usually just food container type things. So. All right, I know we have some questions in Q&A. Sorry, I missed those and I just noticed them recently. So we will go through those. If you guys want to add more questions in there now, this would be the time, and we'll kind of go through and talk about them all. Okay, so first we have a chat that says, from Barbara, that says Amazon has a rabbit box with a low lip. Okay, good to know. And then we have a few questions from Lisa. It looks like we answered the first one already. The second one was about rotating kittens on mom if she has, a large litter. So as we talked about before, like moms can have some nipples that produce more milk than others. So one kitten might get the good one and someone else might not get the not so great one. So one of the techniques you might use is to take the kitten that, they're gonna identify a nipple that's like theirs, and they're gonna be like, this is where I want to go. And what you can do is either pull those kittens off and give the smaller kittens a chance on the good nipple, or you can try to put the smaller kitten on the good nipple, but often those big kittens will bully them out of the way and get back to the one they want to go to. So they tend to associate with a particular one. So you can try that and see if it'll work. And also Lisa mentions pulling out the bigger kittens to allow the smaller kittens chance to nurse without competition. That's definitely an option too. Yeah, good advice. I like those. Shelby, any thoughts on those?
I think the only difficult thing with that would be if you're pulling the bigger ones out. Bigger ones are obviously going to be, or probably going to be healthier, and you're almost going to have to like carry them to the opposite end of the house because they're going to be screaming, and mom's going to be like, what's going on? And like at your door trying to get out. And so she's not going to be attentive to the ones that you want her to be paying attention to.
You'd almost have to wait until those big kittens were full before you
and like passed out before like sneaking them out. And yeah,
or putting them in the carrier and hoping they stay asleep.
Yeah. Yeah. And even then, mom will probably go try to like bring them back. She's like, why are they over there?
Yeah, that's a good point. So you can try those things. It's worth a shot, but no guarantee that they'll work.
Yeah.
All right, Barbara asks, how to identify similar looking kittens for weighing? Good question. So you guys may have noticed that if you take home a bunch of black kittens, we'll mark their ears. But if you're dealing with a kitten whose ears aren't open yet, how do you know who's who? And there's different ways of doing this. You can use like a little safe kind of collars. So I actually have a bunch of like little scrunchies that I can give folks if they have a bunch of similar looking kittens that you can put on them. Although I tend to encourage away from that just because they can get caught on things, and that means a kitten could get caught somehow. So my preferred method is just to mark them somehow. So you can actually just like mark a toe with a little bit of marker, or really try to look for like little individual differences. They can often have just, even if they're black, they'll have like a slightly different facial marking, or weights. Once you get to know them really well, they're going to be different weights, and so you'll be like, oh yeah, this is the one that's right along in this range, and here's my little runt. Shelby, how do you do it?
I had a group of the color point kittens that were white, and I just marked the tip of their tails. But with black kittens, and I haven't had this before, but I actually just recommended this to someone, not a cat foster parent, but she just had some black kittens born, and I said I would just take a pair of scissors and clip a little bit of fur from like their flank, like left side, right side. You don't have to do like a lot, because any sort of clip on their fur anywhere is going to leave a blunt edge. Like they're going to be fuzzy, and then it's just going to be like blunt right there. And so that's how she's doing it, is doing like the back left, like back right, and then maybe like a front left shoulder, front right shoulder, depending on like how many kittens there are. This might be difficult for new foster parents, but like knowing their sexes. So if you've got like 4 black kittens and there's 2 males and 2 females, then you might only have to mark 2 to be able to tell the 2 females apart and the 2 males apart. But if you're not really sure how to sex the kittens yet, you might just have to do it to all 4. I know it might like sound dangerous, but like kittens are typically pretty fluffy, and if you just like take a couple fingers and like grab just a little bit of fur, like lift it up, and then just like psst, it's pretty noticeable. I would only do that on like black kittens though, because those ones are hard to mark, and I try to not. I'm with Mary, like I like using the whelping collars when they're older. I don't like putting them on newborns, and of course it's really important to be able to weigh your newborns and know if there are like what's happening, like if their weight is going up or down. I know some people use like a nail polish on the nails. Also not a fan of that. You got to remember, mom is going to be grooming these kittens too, and so whatever you're putting on the kitten, mom is probably going to be ingesting.
That's true.
So with the black ones, and it's also hard, even with like the older black ones, the ear markings, like they fade. So unless you have those markers to be able to like keep marking their ears, it can be hard to tell. But yeah.
So it's kind of, there's not a definitive answer to that. That's, kind of how we come up with some different techniques, I think, depending on the situation, but
yeah.
Sorry, I'm a little bit distracted because I'm writing down your guys's names so I can send you the quiz and give you credit for attending. Anyone else have any questions? If you do think of stuff later, just you can email us. I can always loop Shelby in if it's something I'm not sure about. But
Wendy asked, how many litter boxes would you want to set up for a group of younger kittens? Would kittens share, or would each one need a litter box? At what age would you want to set out more litter boxes for each kitten? They share. So it depends. I guess it just depends on how many kittens you have and like how dirty you care the litter box gets. So if you've got like 5 kittens and 2 litter boxes, they're going to get filthy really fast. And that just increases like the chance of kittens walking through poop and needing to get cleaned up. So it's really up to you how many you have. Like some people, like myself, will have a bajillion litter boxes in the room, and that way it kind of helps keep the litter boxes clean, and it helps keep the kittens clean, depending on how many kittens there are. It also helps if they're having litter box problems, like they're not using the litter box. In that case though, if they're in a room, what I'll do is I'll stick them in the bathroom with like a litter box or 2. They tend to catch on pretty quickly because they've got an area to go to the bathroom, an area to sleep, and an area to eat. And they don't want to be going where they're sleeping. They don't want to be going where they're eating. So they're going to use the litter box. Hopefully. That usually does the trick really fast. And then I can move them back into my foster room. But it's not like, oh, if you have 5 kittens, you need 6 litter boxes. It's sort of just like what you think is realistic. And
yeah, in the space that you have. Yeah.
Yeah.
Yeah, I know people that do a bunch of the littler ones. So if you're using like the food container boxes, you can do like 3 of those because they're smaller, right? So, you know, you want enough that there's room for a few kittens at a time to be going potty, and that it's not just building up with so much stuff, because you should be changing that out at like 2 or 3 times a day with a bunch of kittens. So
yeah.
if you have like a nice big one, like say you work around with like a big tray, that would be enough. That with that on its own, you probably wouldn't need to like do like 3 little ones. But it is helpful to have them in different areas, I think, like one over in this corner, one over in that corner, just so that they're not too far away from a box.
I like to have, so mom, because mom's litter box is going to be bigger. So if I have a mom, I like to put her litter box wherever I usually put it. And then I'll put a smaller litter box or 2 right next to it. You'll probably notice the kittens just don't care about the small litter boxes at first, and they just want to be going exactly where mom is going. So they'll like do their best to climb over the high edge to get into the big litter box, which is, you know, whatever they want to do. But I do like to put like a more easily accessible litter box next to mom's, because you'll notice they'll watch her and they'll go to try to mimic what she's doing. So that's cute.
All right, I think unless we have any other questions, we're gonna call it. I said I'll send you the quiz, and we will go from there. Let us know if you have questions afterwards, and thanks for coming. Thanks, Shelby, for helping us out.
Yep.
And I will see you all sometime soon, maybe. All right, take care, everyone. Have a good Saturday.
Bye.